Good morning, everyone. First of all, happy International Women's Day to everyone. Together, we gather to celebrate achievements, raise awareness about women's equality, lobby for accelerated gender parity, and women upliftment. For this, I would like to welcome our guest and our speaker for today, Professor Dr. Kavita Kaushal, Principal College of AIMSR, Adesh University, Bhatinda. On behalf of Dolphin PG Institute of Biomedical and Natural Sciences and IAP Women's Cell Uttarakhand branch, I, Dr. Deepthi Variku, HOD Department of Physiotherapy, would like to extend my welcome to our guest today, Dr. Kaushal. Welcome, ma'am. Welcome so much. Now, without
Thank
taking
you.
much of time, without taking much of time, I would like to share the screen with ma'am and would request ma'am to start with her topic for today. Welcome, ma'am, and let us start and let us gather more
Thank you
knowledge
very
about
much, ma'am.
premenstrual syndrome. Thank you and welcome, ma'am.
Thank you, ma'am.
You may start.
Good morning, everyone, and happy Women's Day. According to me, it's we should not celebrate only one day, but we should celebrate every day for ourselves. We should take some time, 10 minutes, 20 minutes for ourselves and celebrate it. But celebration maybe with cup of tea or maybe with whatever you wish to do, your dreams, your creativity, you can do anything in that 20 minutes. Today I'm taking up a very important topic, that is premenstrual syndrome. Now everybody is facing this problem. Some is having low mood or pain, because of new this generation is more switched to the virtual world. They are not sharing their feelings or something. So everything is, they are keeping their inside only. So we get so many issues, so many problems, and our full system gets blocked. So today we will be just, every one of you might be experiencing this symptom or syndrome at any time of your life, from from the age of Mariki, that is 10 to 12 years, to till the premenopausal ladies, they are suffering with this syndrome. Okay, so as per, agar we think what is premenstrual syndrome, so who coined this word or who took it this name, who used this name? So it was again a female. So it was a British physician, Katharina Dalton, in 1950s. She named this condition as premenstrual syndrome. If you see the name itself is suggesting it is before the menstruation syndrome. So any syndrome, any symptoms which is occurring before, just before, within 4 to 5 days before your menstruation, and subsides within 2 3 days, or the just you start bleeding, then the symptoms settle down. So when this kind of symptoms you are having, you are receiving, you are feeling, it is premenstrual syndrome. So if we see by the ICD classification, it is premenstrual syndrome is characterized by the clinical cyclic reoccurrence of combination of various physical, psychological, behavioral, affective, cognitive, neurovegetative, and autonomic symptoms which are experienced by the woman. Here, woman means a girl who is 10 or 12 years old who get the menstruation, and a lady who is having age of 45, 49, or 50 till she does not reach her menopause. So this is the basic, see, structure. If we see how many changes we are receiving in this syndrome. That's why it is called syndrome, basically, because it is multifactorial. So physical also, psychological also, behavioral also, affective also, cognitive also, neurovegetative also, autonomic symptoms also. So many things are there, according to the guidelines around, or according to WHO, I must say 150 to 200 symptoms are there, which are comprises of premenstrual syndrome. So if anybody is having any symptom from 150 to 200, it's a long list to go. So we tag it as a premenstrual syndrome. Okay. Now, international classification 10, as per 22 status of the classification, it may be defined as the occurrence of one of distressing premenstrual symptom among many symptoms. ठीक है, 150 और 200 में से कोई एक सिम्टम का होना is called as premenstrual syndrome. For example, mild psychological discomfort, feeling of abdominal bloating, sleep disturbances, various aches in the body. So, how many of you are experience any kind of thing? Maybe every one of us, right? Simple. Sometimes we say I'm very hungry when I'm approaching towards my menstruation dates. Sometimes think we feel our weight is increased. Sometimes we feel my appetite is reduced, or there are so many things which we feel and we just ignore it. The prevalence is 100% as in many places and as per record. So 100%, mostly this 100% is because of the variation of the diagnostic criteria, or approach towards collecting the data is different. Maybe that's why it is from up to 100%. If we see, only 15% women are asymptomatic, जिनको कुछ नहीं होता. ऐसा नहीं है कि उनके उसमें केमिकल चेंजेस नहीं हो रहे हैं, पर उनको कुछ नहीं पता चलता. ठीक है. 50% have mild PMS syndromes, 30% have moderate, 5 to 10% have severe PMS symptoms. As per the World Organization and the guidelines of American College of Obstetrician and Gynecologists and the National Institute of Mental Health, to diagnose premenstrual syndrome, a woman should show any symptom or symptoms from somatic as well as effective symptoms list, and these symptoms should ease once the flow start. These symptoms should be present during the luteal phase only. This is the biggest point. The, you say, underlined phase, or red light between the brackets, luteal phase only. That means whatever is happening, it should happen 2-3 days before the menstruation, and it should ease off once the bleeding start, or within the 2-3 days of the menstruation. So only this phase, only 10 days, including your menstruation pre and post days, the symptom should vanish off. If they does not, then it will be premenstrual dysphoric disorder. So this is a very thin hairline difference between PMS and premenstrual dysphoric disorder. Only this is, the symptoms will be in luteal phase, in that the symptoms will be in follicular phase also. This is the only difference where we can see. Now, what are the effective symptoms and what are the somatic symptoms? Effective symptoms are like depression. I won't say depression. I will consider it, I'm low, I'm hopeless, I don't want to talk. Depression, I feel depression is a big deal, big talk, big thing. But if I'm low, I don't want to talk, I don't want to do anything, these kind of feeling is effective symptom. Anger, suddenly we start shouting on each other, on friends, on kids, on husband. So this is one symptom. Irritability, see, irritability changes relationship, interrelationship of a person. So whenever somebody coming to me, I'm irritated, and shout on that person. That that sometime I realize also कि I'm shouting unnecessarily, but sometime, or it becomes my habit every time it is coming. So I don't accept it as a habit. Then anxiety. Oh, sometimes I get very frustrated, or I get very anxious ki how I'm looking, how people will say. These are all effective symptoms. Confusion, social withdrawal. Sometimes you see a friend does not come out to play with you. She's just sitting, crying, and we always say you are always a crybaby. Anna? So these symptoms are, maybe she is showing PMS. We have to be very cautious when we are dealing such kind of people. Then in somatic symptoms, breast tenderness, abdominal pain, headache, swelling of the extremities, water retention, and bloating. I'm just, writing. These are the most common symptoms we have gathered so far. Out of 200, 150, we have gathered these are the most common symptoms. Okay. So etiology is unknown. Why? There are many theories, because no one knows the exact way क्या है. ठीक है, एग्जैक्टली होता क्या है. सम से कि ओवरियन एक्टिविटी एग्जैजरेटेड होती है ड्यू टू ओव्यूलेशन, इसलिए ऐसा होता है. सम सेज central increased responsiveness may occur due to the combination of steroid, chemical messenger, and GABA plays a big role in all this. So it is maybe just a triggering, or some people are psychologically very sensitive. So these are the main cause, but still the etiology is unknown. If everything is fine, everything is going normal, then still we are getting it. So we have to give a chance for all these things, like ovarian activity कितनी हो रही है, then chemical reactions कौन से हैं, steroid activities कौन सी है, and most important, it's psychologically sensitivity hai कि नहीं. If we see, the COVID has made us more psychologically sensitive, right? We feel if somebody just smiling or just laughing at us in a, in a good way also, we take it a very negative way. So how we can diagnose it? Diagnosis is something which is, now by now many of you will be thinking, which one I'm receiving, which symptom is coming to me. Oh, this symptom is also coming, this symptoms is also coming, this is also coming. So but this symptom is coming, but may not be this symptom is coming in next cycle. It may be some girl got the blotting of abdomen today in first cycle, or this cycle. Maybe she does not receive the same bloating episode in the next cycle, menstruation cycle. So there are variety of things. So don't burden yourself ki, oh, I'm PMS, I'm having PMS, and you write application, ma'am, give me a leave because I'm having PM syndrome. No, it is quite normal. So what we have to do, we have to make a chart, daily severity rating symptom diary we have to maintain, and we have to maintain it for at least 2 months as per the guidelines, but few authors has recommended 6 months also. But as per the guidelines, 2 months maintaining of the diary is compulsory. Now, and symptoms chart. I said that these are the most common symptoms. 5, 6 symptoms are most common. Maybe you will be having hair fall. You might be having itching skin. So you might be having more movement of your uh, intestines. Many things will be there. Could be there, so you have to write it down. Then most important, you have to know about your mother's history, whether she used to find has experienced this thing, whether she was knowing this thing. And mostly I must say कि our mother will say, यार हाँ ये तो होता ही है बेटा, ये इसके साथ ही है, साथ ही है, definitely साथ है. What we should do for it? I can't be sitting in the room and crying and doing nothing. My mental health will be affected. So I have to be very cautious what my mother used to do and what kind of symptoms she used to get. Once I know what it is, I can handle it. If I am not knowing about it, I can't handle it. So I have to make a chart of the symptoms. And I have to tell my partner, my husband, or my friend, see, I'm having my periods on, I'm bit irritable, I'm having low mood, kindly don't mind, so that my interpersonal relation does not get affected. You know why PMS become the part of international classification of disability? Otherwise, if we see, menstruation is a common phenomena, physiological phenomena. So how come a common normal physiological phenomena become the disability? It becomes disability because it affects my interpersonal relationship. I'm bunking my work, I'm bunking my college, I'm bunking my classes. Everything is hampered. I don't go to kitchen, or I don't do my puja. So many things are there. So this everything in that case is hampering. That's why it is in disability. You must be knowing what is the definition of disability by now. So this is the most, you know, crucial thing for us. We should, I on Women's Day, I don't want to feel like a disabled person. So I have to know what's happening with my body, what's happening in me. So we have to follow the National Association of PMS guidelines. They have given they have charted it. You take the diet like this, and you eat this much, use these many medications. So we have to follow that also. Disruption of work and interpersonal relationship, I said कि ये खराब हो जाते हैं, इसीलिए we become into in a disabilities. So interference with normal activity. मुझे नहीं खेलना, हमारे छोटी सिस्टर है या बच्चे हैं, बेटी है, मुझे नहीं खेलना. Then what a mother should do? Mother should talk. Elder sister should talk about it. You see, this is nothing. You have to come out. See, coming out of such kind of uh, psychological barrier is not difficult. If you extend your hand to the person and that person hold your hand, only if the both the hands meet each other, then only you can take that person out and make that person realize, you see, this happens, so we have to break the barrier and we have to take it towards normal life. Okay, this is daily record of severity of problems. See, it's written felt depressed, sad, down, or the blue, and I felt hopeless, felt worthless or quiet, है ना, ये सारे हैं. Then what I will do? Today I was feeling such feeling. No, this I have to feel in the end of the day, right? Next day I felt nothing, 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 nothing. Again, now I felt I'm little bit sad. Yes. Okay. I ticked over here. Then other symptoms are coming. I will keep on ticking on it. And after 8th I start ticking, and it should go up to 12th, and on 12th I get my menstruation started. So on 13th or on 14th these symptoms vanished. Many of girls have seen this. Their body is stiff, they are, they feel as if they are, congested in some sitting in some place, or their body is tightly packed, and suddenly after the flow starts their body gets relaxed. So this I have done for 30 or 31 days, है ना, 30 or 31 days. Only for 3 to 5 days in which I am getting periods, in that phase only I might be having 4 to 5 to 6 symptoms also, maybe. But after that, no symptoms is there. I don't have any problem. On off I might be having a problem. So I might tick over there. Different treatment strategies are given for, premenstrual treatment. Many guidelines are there, many approaches are there. The most promising is cognitive behavioral therapy and aerobic exercises. See, not even a single strategy. If I say I'm on a hormonal therapy, I'm on a multivitamin, nothing will work. Single recipes are not very successful. We have to do combinations. So while dealing with such kind of problem, we have to realize ourselves what is triggering and what is easing me off. So once I know ki if I do exercises daily, I don't get the menstruation symptoms. And if I take B complex also along with, I feel more better. So this is two things you are adding. One, you are taking the supplementary drugs, and you are combining it with your exercise, or your daily walk, or your aerobic exercises, or just you are doing PT, right? In schools we used to do PT, right? All the limbs used to be moved at a particular speed. So this will give you a better um, treatment, or the results will be good. Both the treatments, both the strategies you can use in premenstrual dysphoric disorder also, and premenstrual syndromes also. And how can I cope with PMS? First is lifestyle change. Like, if you're working in corporate office or in college or somewhere, you are living a sedentary lifestyle. Like myself, I keep on sitting for some time in a meeting, maybe for 6 hours, and do not do any work. I'm likely to have any symptoms out of the listed one, 150 or 200. Like overweight will be there, I will be eating more, maybe, or I'm more fascinated towards the sweet dishes. These kind of things will be there. So I have to change my lifestyle first. So lifestyle changes is doesn't mean ki you have to change your clothing, you have to, go to parlor and brush it up and everything. Lifestyle changes mean you have to work more for yourself. You have to eat healthier for yourself. You have eating, working out is all everybody is doing. Everybody is performing very nicely, very good. They are doing it. What about our mental health? Nobody pay any attention on mental health. Just think for 2 minutes or 1 minute. Do you know what is your mental health? When we read that Deepika Podkon was in depression, Jacqueline was in depression, we say, huh? How come? हमें तो डिप्रेशन नहीं होती है ना? But we are not aware what is depression. When I say कि I'm alone, when I say कि I'm lonely, it's all about thinking. What I'm thinking. See, the negative pole attract positive pole. So negative thinking attracts depression, loneliness. Okay? So I have to channelize things accordingly. If somebody is laughing at me, I can always, or looking at me again and again, I can always boost myself. Yeah, I'm looking smart. That's why she is looking at me. Or she was shouting at me, yelling at me. She might be having a bad mood. Now you can say she might be having PMS. Anna? So we have to channelize our thoughts, our energy. Like I said, I'm working, I may sit for 6 hours in a meeting. So mentally I'm working, but physically my energy is not consumed. So I have to channelize, I have to send that energy to some positive or right action. So right action in that case is not fighting with someone, it is going for a walk, and walk not with the phone and doing, gossip with your sister. It is going walk and listen to the music of, universe. How many voices are there, so many birds, different birds might be chirping, the leaves, different trees leaves are moving in a different sound, they are producing. We have to channelize it, we have to think about it. All the negative thoughts we have to push them out. No, if somebody said ki you are useless person, then you keep on telling yourself, I'm useless, I'm useless. That person said only once, but you yourself telling it for 100 times that you are useless, and your brain recognize it, yes, you are useless. So it's better not to think so negatively. So if you do more exercises, you feel good, hormone will be there, and you will be bulby all the time. Then multivitamins play a very good role. Vitamin D, B12. See, Indian women are always having the less red blood cell count. HB might be high, but the red blood cell count is less. So B12 plays a very big role in producing RBCs. So we have to take B12, B6, or B complex capsules or supplements, calcium. Then evening oil is very good. If you remember, our granny used to do malish or massages when we used to be very tired. She used to say, okay, come, I'll massage you. that soothe your aches, your body, your mind. So these things are helpful. So healthy diet. Don't go for intermittent dieting or don't go for keto diet. Eat healthy. Now, what healthy? If I say ki I'll go to pizza shop and I will have a farm fresh pizza, it's healthy. No, it's not. So we have to think what we are eating. The most important in that is maintain genital hygiene. That gives you a different, confidence. If you feel you are hygiene. You take bath daily, doesn't matter, but for every use of toilet, if you clean yourself, you wash yourself, you feel better. Strategies of management. So self help techniques hai sari ki sari, I explained very nicely. सारी की सारी सेल्फ हेल्प टेक्निक्स, डाइटरी ऑल्टरेशंस आपको करनी पड़ेंगी. लेस फैट, लेस शुगर, लेस सॉल्ट, लेस कैफीन एंड लेस अल्कोहल. You have to take complex carbohydrates, like you can take oats, you can take jawar, so that it takes time to make glucose out of that, and your body, your BMI, your sorry metabolic rate gets improved. Take fruits, whole vegetables, and more of fiber. One more, 4 early small meals or snacks. When I say complex carbohydrate, don't shift to the oats, cookies, or something, you know. The cookies, oats cookies, and normal biscuit has the same calories, same level of energy they uh, give. So take the basic one only. And four early small meals is preferable. Like if you have taken your breakfast at 8 o'clock and you are eating your lunch at 2 o'clock, in between what you didn't had anything, is a problematic issue. Then do exercise, moderate regular aerobic exercise, more of cardiovascular workout you should do. For the stress reductions, relax techniques, meditation, breathing techniques, yoga you can do. You can add up breathing exercise, just diaphragmatic breathing, you can relax you. Cognitive behavior therapy, complementary therapies, and self awareness therapies are also helpful in this. Non-hormonal things are there, drugs are there, which you have to take in luteal phase only. Then sometimes the drawback of this is that the symptoms or the side effects of the hormonal therapy or medication affect you. So you have to be cautious when you're taking all the drugs. Antidepressant, they say it worked in very few patients. Mind and body therapy, like aromatherapy, reflexology, naturopathy, they helps. Actually, basically they are relaxing you, so that's why it is helpful. Homeopathy, homeopathy shows 90% relief in PMS. I could not find much support for this article, but line, but definitely 3 4 articles showed 90% improvement was seen in PMS with homeopathy. So the next most important thing is menstruation hygiene. So, menstruation hygiene management was brought into India in 2015, under the Ministry of Drinking Water and Sanitation. They have issued the guidelines so that every state can do their bit at different level, from the Anganwadi to the district level. Everywhere it has to be done. the menstruation hygiene is all about, it has a tripod. Like, you have to provide the sanitation, you have to provide the disposal, you have to provide the absorbent also to the female. Many female use cow dung as a absorbent. Like, many of us now using tapoon or sanitary napkins or something, and few I should say ki many females still use cow dung as a absorbent. So we have to stop, because it will increase the health issue in them. Okay, it is a joint venture. Menstruation hygiene management is a joint venture of WHO and UNICEF. Okay, according to them, the women and adolescent girls are using a clean menstrual management material to absorb or collect menstrual blood that can be changed in privacy as often as necessary for the duration of menstruation period, using soap and water for washing the body as required, and having access to safe and convenient facilities to dispose of used menstruation management material. They understand the basic fact linked to the menstruation cycle and how to manage it with the dignity and without discomfortable. How many of you know कि we can walk down in Taj Mahal Hotel also, the Taj of Bombay also, to use washroom, and they will not say anything? What we use, no, we should not go here. They will charge, they will ask, you have used our washroom, or we have to buy something. But this is our right, nobody can stop us to use their washroom. So the tripod of the MH is, I said, ki giving the infrastructure, material, and dispose of. And most of it is the basic thing is the breaking of the silence, that I should able to speak this to my daughter, I should speak this to my in front of my husband to my daughter. So I should provide, or my daughter should have, the good absorbent material in the school itself. Okay, this is the main motive in menstrual hygiene management. And the dispose of the material is come under the solid waste rules. जैसे सॉलिड वेस्ट हम मैनेज करते हैं, वी हैव टू मैनेज द सेम थिंग इन दैट वे. Somewhere in Himachal, or maybe in your area also, you are digging the ground and putting your stuff over there. So this is not allowed, or this should not be happen. So we have to stop this. Okay, I'll show you one very beautiful video, and I hope you will like it. I think I'm not able to play it.
As a child, I loved red cherries, red balloons, red ketchup with hot samosas, red toys. Red was the color of my mother's bindi. Red, the cross on the doctor's car. Red mehendi, red frocks, red roses, red candy bars. Red was beauty, was love, was passion, was dreams. And then I grew up, and something changed. Goodness of red escaped from a crack, and it became the color of shame, of pain. I was around 11 when I saw Red River flowing between my thighs. I was frightened, confused. I have blood cancer, I thought. I didn't know that this blood would become my lifelong adversary, that red would become my nemesis. My life would now be full of don'ts. Don't walk like that. Don't talk to boys. Don't dress like that. Don't think like that. Shh! Don't speak about those things. Don't go out late. Don't go to the kitchen. Stop! Don't pray! 5 long days, days of impurity, living life of an untouchable, living life like I didn't exist. 5 long days that I had to bear on my own, uncertain, uncomfortable, ignored. 5 long days when even God wiped me off his list. Can you imagine the horror of the 11-year-old girl who suddenly discovers that she's become a woman and it's nothing beautiful? She's not beautiful. She feels tainted. She feels ashamed. And I was not the only one. There are many like me who step into puberty not knowing that their bodies are the most beautiful vessels, vessels with the power to bring forth humanity. Surrounded by myth, burdened by taboo, they consider themselves a curse. They learn no hygiene. Rags, ashes, leaves, they use any means to remove all traces of shame. They drop out of school, they withdraw into themselves, wondering why their body limits them, who clipped their wings. For humanity to live, they bleed. They have 1,000 questions that they are too scared to voice, too ashamed to think. But they need to be told, the children like me, that womanhood is not a witch, that puberty means life, that menstruation is not a disease. With care, understanding, and knowledge, give her the strength to untangle the barbed fences, to break societal taboo. Talk to her, discuss it, tell her that she has magic within her, and it's wonderful, and that the red blood that comes from within her doesn't make her dirty, impure, and that her red blood will one day help another heart beat.
I think you liked it. Thank you very much.
Thank you so much, ma'am. It was a wonderful lecture, and I'm sure after your lecture we are going to have less number of sick leaves from our students, and it was very informative. Once again, I would like to give my thanks on behalf of Dolphin PG Institute of Biomedical and Natural Sciences, Department of Physiotherapy, DIBNS, IAP Women's Cell, Uttarakhand. Thank you so much, ma'am, and happy Women's Day.
Thank you. Thank you.
Thank you, ma'am.